Hello, everyone. Hi, Dee. Hi, Linda. Hi, Pamela. Hi, Susan. Welcome. Hi, Mary. Let's do a quick test of the chat. If you can hear me and you can see the screen with the Medicare 101 slide on it, go ahead and say something in the chat. Great. Thanks, Dee. Thanks, Linda. Just out of curiosity, could everyone post in the chat where they are zooming in from? Mm-hmm. Wonderful. I'm in San Francisco, and it's the fog is a little higher than usual, and I can see the blue sky peeking out from beneath it. So we'll just give folks time to join. It's not even 6 yet. We'll give everyone until 6:02, and then we'll kick things off. Mary, you're raising your hand. Feel free to ask a question in the chat or in the Q&A part of Zoom. Mary, because there are a lot of people who are going to join the webinar, I'm the only one who can speak or who you can see, but you can ask questions in the chat. You should be able to see my screen, which says Medicare 101. So the presentation will be about 40 minutes, and then we'll have 20 minutes for Q&A. Okay, it's very nearly 6:02, so let's go ahead and get started. If you have any questions as I'm going through this, feel free to stick them in the chat, and I'll do my best to pause and address them, or I'll address them after the presentation. So without further ado, Medicare 101. So just a quick introduction. I'm Dan. I'm the CEO of a company called Fair Square Medicare. I have an interesting history in getting into the Medicare space. Previously, I was in the technology business in San Francisco. I worked at a couple of tech companies. I started a tech company in the personal finance space and actually got interested in Medicare. And way before that, I got a physics degree from Yale. I got into Medicare after watching my own parents struggle with it. So they came over here when they were 27 from the Soviet Union. They've been living in Houston, Texas for the last 40 years. And when they turned 65, they had all these questions about Medicare. It was super confusing. And the core problem was that they were used to a website that they could go to that would give them the best choices for them. And unfortunately, up until we launched Fair Square Medicare, that just didn't exist. So they either had to go to their local agent who gets paid more when you buy a more expensive policy, ehealth.com, which is just a list of policies and therefore confusing, or all these other online brokerages, which are at best confusing and at worst predatory. So I decided to build the experience that I wish they had, which is Fair Square Medicare. You go online to this website, you answer 8 questions, and then we take all the plans that you could possibly choose from, and we remove all the ones that don't cover your doctors and all the ones that just cost more for less coverage, and then we show you that resulting shortlist. And then if you want to enroll in them, or if you have a question, you can get on the phone with a licensed agent, which right now will be me. We always have the lowest cost plan, and we show a list of plans regardless of whether or not we make money on them. So I'm going to go through this presentation. I'll teach you all about Medicare 101, but the goal here is not to make you an expert, it's just to make you generally informed. If you want to get in touch with me, you can go to our website, fairsquaremedicare.com. You can call me or you can email me. So the agenda, quick introduction. We've already done that. We're going to spend 40 minutes on Medicare 101, and then we'll do a 15-minute Q&A at the end. So the metaphor I use to describe Medicare is that it's a lot like getting ready to go outside on a cold day. In the same way that you put on layers of clothing before you feel warm enough to go outside, you put on layers of health insurance until you feel good about the level of health insurance you have. So your base layer, the layers you put on first, are Medicare Parts A and B. Then some people are fine with that, but most people want to put on an additional layer on top of that. Now that can be Medicare Advantage or Medicare Supplement plan. And then you feel good about health insurance. So let's start with Medicare Part A. So Part A covers hospitalization. Specifically, when you are admitted to a hospital, you're on the hook for the first $1,408. That's your deductible. Now, this deductible resets every 60 days, which is an important detail, and I'll come back to that later in the presentation. After you pay that deductible, you're fully covered for days 0 to 60 in the hospital. After day 60, you pay $352 a day until day 90. After day 90, that's $704 a day. Until day 150, then you're on the hook for everything, okay? Hospitalization is the main form that people use Part A. You also are covered for care in a skilled nursing facility. Now, usually this is the care you receive when you're checked out of a hospital. So if you've stayed in a hospital for at least 3 days and you're checked into a skilled nursing facility, you're fully covered for days 1 through 20. Then for days 21 to 100, it's $176 per day. And then you're fully on the hook for everything after day 100. Hospice care is fully covered. Home health care is covered, but the rule of thumb here is that full-time healthcare at home is not covered. So Medicare does not cover a live-in caretaker. It doesn't cover 24-hour daycare. It doesn't cover daily meal delivery. But if someone is coming to your home to give you physical therapy that your doctor says you need, it'll cover that. Now, the good news is that for most people, Part A is free. If Medicare tax has been taken out of your paycheck for at least 10 years, or if you're self-employed, you've been paying Medicare tax quarterly for at least 10 years, Part A is entirely free. If that's not the case, then you have to pay a premium for Part A. But for most people, it'll be free. When to enroll. So you have what's called an initial enrollment period around your 65th birthday. And this period is when you should enroll in Medicare Parts A and B and any additional coverage. It starts 3 months before the month of your 65th birthday and ends 3 months after the month of your 65th birthday. Now, if you're enrolling in Medicare, the optimal time to do it is at the very beginning of this period, because it usually takes 1 to 3 weeks for your enrollment application to be processed and approved. And then only after you've enrolled in Parts A and B can you then get a Medicare Advantage or Medicare Supplement plan. So you want time to do that. So I recommend enrolling in Parts A and B at the very beginning of this enrollment period, which is 3 months before the month of your 65th birthday. Common question I get is, do I need to enroll in Part A if I'm covered by my employer? The short answer is technically you don't, unless you have to pay Part A premium. The way to think about this is, if you have an HSA, you can defer, and you want to keep contributing to it, you can defer Part A. If you don't have an HSA, or you're fine not contributing to an HSA, I would recommend enrolling in Part A as soon as you enter your initial enrollment period. How to enroll. So if you're already collecting Social Security, your enrollment is automatic. You don't have to do anything. Otherwise, you can go online, medicare.gov, or you can go to your local Social Security office. It takes up to 3 weeks for your application to be approved. It can be shorter. Earlier today, we had a client who got approved after 1 week. After you're approved, you'll get this beauty, your Medicare card, in the mail with your Medicare number. So that's Part A. Here's a quick summary of it. I'm going to skip the next slide, but if you review this deck afterward, you can look to this slide for a quick summary. Medicare Part B. Okay, so Medicare Part B covers medically necessary services like x-rays, blood tests, or surgery. It covers preventive services like bone density screening, heart disease screening. There are a ton of these tests, these screenings that it covers. Ambulance service, durable medical equipment, mental health counseling and therapy, and then certain drugs that are typically administered in a hospital setting, like drugs for diabetes or chemotherapy. If you have a question about what exactly Part B covers, this is the website to go to. Now, generally, there are annual wellness visits and there are preventive screenings that happen once or once every 2 years that are free under Part B. But for everything else, you pay $198 annual deductible. And once that is met, you're on the hook for 20% of expenses. Your premium for Part B depends on your income. So, and more specifically, your income 2 years ago. So if in 2018, your tax return shows an income of $87,000 or less, and you filed individually, your monthly premium for Part B will be $144.60. If you file jointly, it'll be $144.60 if your joint income was less than $174,000. And you can use this chart to figure out what the premium is going to be for you based on your income. Now, when to enroll in Part B. So if you don't have coverage from your employer or your spouse's employer, you should enroll at the same time that you enroll in Part A, at the very beginning of your initial enrollment period. If you do have employer coverage, you have the option of deferring Part B. And people do this to avoid paying their Part B premium. And so here's how to think about that. If you have coverage from your employer or your spouse's employer, and that employer employs more than 20 people, and you call your employer's HR team and you confirm that their insurance pays, their group plan pays before Medicare, then you have the option to defer enrolling in Part B, right? And so what's going to happen there is you're just going to enroll in Part A, okay? And you're going to be on your employer's health plan or your spouse's employer's health plan all the way up to the point at which you're no longer covered, right? Maybe you retire, your spouse retires. And then at the point that you lose your employer's health coverage, you have an 8-month period to enroll in Part B and any additional coverage, which could be Medicare Advantage or a Medicare Supplement plan. Now, there is a penalty for not enrolling in Part B if you don't have coverage from your employer. So I highly recommend enrolling in Part B on time. You enroll in Part B the same way you enroll in Part A. It's done automatically if you're collecting Social Security, or you can go online to medicare.gov or visit your local Social Security office. And again, once you're enrolled in Parts A and B, you'll get this beautiful card in the mail. Okay, so once we have Part A and B, that is our base layer of coverage. And now we can look at additional layers of coverage, maybe a jacket or a sweater. Now, 70% of folks purchase some coverage beyond Parts A and B. And I'll tell you why. There are two big gaps, two holes in Parts A and B. The first is the Part A deductible that resets every 60 days. So what does that mean? It means that if I show up in a hospital and it's been more than 60 days than my last hospital visit, I have to pay this $1,408 deductible before my Part A benefits kick in. So that means I could theoretically go to a hospital multiple times in the year, and as long as those stays are more than 60 days apart, I'd have to pay a deductible of $1,408 each time. So that can obviously add up. So that's one problem with Part A. And then with Part B, there's a normal deductible in the sense that it's annual and it's $198. But once you reach it, you're on the hook for 20% of expenses. And 20% of a big number could be a big number. So there are two forms of additional coverage that people can buy to fill these gaps. The first one is a Medicare Supplement plan. So if you've ever heard of Plan G, Plan F, Plan C, these are all Medicare Supplement plans. It used to be that Plan F was the most comprehensive one. Starting January 1st, 2020, Plan F is no longer available to folks who newly qualify for Medicare. So now Plan G is the most comprehensive one. So these Medicare Supplement plans are sort of like super PPOs in the sense that they let you see any doctor in the United States who accepts Medicare. The premium for them is paid on top of Part B premium, and the plans are the same no matter the carrier. So Plan G from Aetna is exactly the same as Plan G from Blue Shield California. The only difference is going to be the premium. And one thing to note about these plans is that the premium does typically increase as you age. So I'm just going to put a quick spotlight on Plan G, which for new folks enrolling into Medicare is the most comprehensive plan available. And I'll walk you through the benefits. And just to give you some context, in most parts of the Bay Area, you can buy this plan for $93 to $130 a month. Okay, so let's do a quick line by line. So remember earlier for Part A, there's a certain fee per day that you have to pay to be in the hospital past 60 days. Plan G covers that completely. Now, with Part A, you can only be in the hospital for 150 days before you're fully on the hook for all expenses. Plan G gives you an additional 365 days of full coverage, okay? With Part B, with normal Part B, you have 20% coinsurance for any medical expenses. Plan G covers that entirely. With normal Part B, you actually pay for the first 3 pints of blood. Plan G covers that. Similar thing for Part A coinsurance for skilled nursing coinsurance, Plan G covers your daily fee. Notably, Plan G covers that $1,408 deductible. It also covers excess charges. So what are those? If you go to a doctor who doesn't accept Medicare, they can bill you 15% more than the Medicare approved rate for a given service. And normally you would be on the hook for that. But with Plan G, you're covered for that. And it also covers 80% of expenses for travel emergencies abroad. Now, one thing you might hear when people talk about Medicare supplements is, hey, the rate increases every year. That is true. And if you're interested in purchasing one of them, I can show you how the rate is expected to increase over the next 20 years. One thing to keep in mind, though, is that in California, around your birthday, you can switch from one plan G, one Medicare supplement plan, to another. So what that means is if you're on Plan G and you turn 75 and now your Plan G from Blue Shield costs $250 a month, we can switch you to a cheaper Plan G if it's available. So if there's a Plan G from, say, Cigna that's $200 a month, we can switch you to that. And we can, every time you have a birthday, we can switch you to the lowest rate for the plan that you're on. Okay, so I've been talking about Plan G, but there are actually 10 Medicare supplement plans available. So how do you make sense out of all of them? Well, there's the do-it-yourself way. It's head exploding. So how do you make sense out of all of them? There's the do-it-yourself way, which is you find all the Medicare supplement plans in your area. For each letter, you find the cheapest plan from a carrier with an AM Best rating of at least A. And then you get rid of all the plans that cost more than Plan G, because it doesn't make sense to pay more for less coverage. And then you consider those. Or you can go to fairsquaremedicare.com or call me and I'll do all that for you. So that's Medicare supplement plans. The next type of additional coverage you can purchase is a Medicare Advantage plan. So Medicare Advantage plans tend to be cheaper than Medicare supplement plans. Some Medicare Advantage plans actually are free, so they cost nothing on top of your Part B premium. They can come in two flavors: PPOs, which let you see doctors in network, and also doctors out of network, but it's more expensive to do so, or HMOs, where you can only see doctors in the HMO, and to see a specialist, you need a referral from a primary care physician. Most Medicare Advantage plans include drug coverage, and a lot of them come with extra benefits like free gym membership and some dental or vision coverage. Medicare Advantage plans don't have a deductible, and they tend to have different copays for different services. So if you evaluate a Medicare Advantage plan, you'll actually see a list that looks kind of like this. So this, I think, is Anthem MediBlue, for example. A primary care visit is $10, specialty visit is $35, an ambulance is $325, chiropractic services are $20. And they also have an out-of-pocket max. So for most plans, it'll be about $6,700. The out-of-pocket max is the max that you will pay for healthcare in a given year. So let's say you have an unfortunate year and you pay for x-rays and surgery and whatever. Once you reach $6,700 of spend, the plan has you fully covered. So a quick comparison of Medicare Advantage plans versus Medicare Supplement plans. With a Medicare Supplement plan, you can see any doctor who accepts Medicare in the entire United States. With a Medicare Advantage HMO, you can only see doctors in the HMO. With a Medicare Advantage PPO, you can see doctors who are in-network and out-of-network, but out-of-network coverage, out-of-network doctors are more expensive. Do premiums increase with age? For Medicare Supplement plans, yes. For Medicare Advantage plans, no. Is the premium paid on top of Part B premium? Yes, for all of them. What do they cost? Medicare Supplement plans tend to be more expensive than Medicare Advantage plans. Is drug coverage included? Not for Medicare Supplement plans, you'll need to buy another separate prescription drug plan, which is easy to do, it's not a problem. Drug coverage is included for Medicare Advantage plans. When do you enroll in a Medicare Supplement or a Medicare Advantage plan? You do it in that same initial enrollment period. right? 3 months before your 65th birthday to 3 months after your 65th birthday. I strongly recommend you do it in the 3 months before your 65th birthday so you can have your coverage start the first of the month of your 65th birthday. So the first thing you're going to do enroll in parts A and B. It'll take 1 to 3 weeks. And then once you're enrolled in parts A and B, then you can enroll in a Medicare Advantage or Medicare Supplement plan. Now, how do you make sense of all of this? How do you choose a Medicare Supplement plan? How do you choose a Medicare Advantage plan? You can use fairsquaremedicare.com. We'll show you all the PPOs in your area. If you give us a list of doctors, we'll show you all the HMOs that cover those doctors. We'll also show you Medicare Supplement plans in your area. Or call me and I'll do this analysis for you. Okay, we are nearing the end of our presentation. We're going ahead of schedule, which I think is good for everybody. The last thing we're going to cover is standalone prescription drug plans. So who needs a prescription drug plan? Okay, so first, if you're deferring Part B, if you're deferring Part B, you need to confirm with your employer that their insurance offers creditable drug coverage. Okay, if they say yes, then you don't need a prescription drug plan. If you're enrolling in a Medicare Advantage plan, you don't need a prescription drug plan. If you're enrolling in a Medicare Supplement plan, or you're not enrolling in any additional coverage, you need a prescription drug plan. Okay, and even if you have no prescriptions, you still need to enroll in a prescription drug plan. The government requires that you have some form of prescription drug coverage, either from a private carrier or your employer. If you don't have insurance from your employer and you don't sign up for a prescription drug plan, you'll pay a penalty when you eventually do. A few basics on prescription drug plans. Every plan has a list of drugs it covers called a formulary. And included in the formulary is not every drug available, but rather drugs from every category, a certain set of drugs from every category of drug in the world. The drugs are categorized in one of 5 tiers. So starting at the cheapest, there's preferred generic, then preferred brand, then brand, and then specialty. Specialty is the most expensive tier. So your preferred generics under a prescription drug plan might cost you $1 a month, whereas your specialties can cost you significantly more. Most prescription drug plans will have a deductible of $435 or lower, but it won't apply to every tier. So for many prescription drug plans, you get coverage for preferred generic or generic drugs, even if you haven't met your deductible. Now, you may have heard of the donut hole before. How much your prescription drug plan covers your different drugs actually depends on how much you've spent on drugs in a given year. So if you've spent $0 to $4,020, you're in your initial plan stage. So your plan is typically going to do a relatively good job of covering you. Once you spend more than $4,020, you've entered the coverage gap. This is the donut hole. Typically, plans cover you, give you less coverage when you're in the donut hole. And then once you've left the donut hole by spending more than $6,350, you're in the catastrophic plan stage. And then your plan coverage goes back up. How do you choose a drug plan? Again, this is where we can help. The do-it-yourself way is you list out all your drugs, find all the plans that cover your drugs, figure out which tier each of those drugs fit into, find the retail price of each drug, and then crunch all the numbers and figure out what plan you should choose. The easy way is to just call us and we'll do it for you. So going back to our original metaphor, enrolling in Medicare is a lot like going outside on a cold day. First, you put on your base layers. That's parts A and B. And then you put on your outer layers. That's Medicare Advantage or a Medicare Supplement plan. And then you feel like you're ready to go outside or like you're ready to face the world confident that you have good health insurance. We don't expect you to be experts after this presentation. And if we can help in any way, feel free to reach out. You can use our website, you can call me, or you can email me. So that concludes our presentation, Medicare 101. If you have any questions, feel free to put them in the chat or in the Q&A section. Sure thing, Pamela. Thank you. Susan is asking, is Plan G an Advantage plan or a Medicare Supplement plan? So Plan G is a Medicare Supplement plan. So it's the benefits of Plan G are defined by the government, and Plan G itself is offered by many different carriers. So Plan G from Blue Shield is going to be the exact same as Plan G from Cigna and exactly the same as Plan G from Aetna. So all you have to do if you want Plan G is find the cheapest carrier and then enroll. And then every year at your birthday, we can ask that same question, like, hey, what's the cheapest carrier? And switch you to that. So you'll always have the lowest cost coverage. Plan G for most carriers does not have dental and vision coverage. And I typically advise folks to think hard about dental or vision coverage because usually it's cheaper to just pay cash for vision or dental services. There is a version of Plan G called Plan G Extra from Blue Shield that offers limited dental and vision coverage that if you're interested, we can take a look at. Susan asks, is there a Plan N? There is a Plan N. And Plan N is a Medicare supplement plan. It has fewer benefits than Plan G, but it's a popular plan. You do. So Mary asks if her Medicare starts the 1st of November, does she have time? You do. So if your birthday, Mary, I presume your birthday is in November. Is that right? Yeah. Yeah. So you have 3 months before November to enroll in all of this stuff. So that's working backwards, October, September, August. So this is the first month of your initial enrollment period, right? So I would suggest you go ahead and get enrolled in Parts A and B. And then I would also, as soon as you're done with that, get your additional coverage, whether it's an Advantage plan or a Medicare supplement plan, and you'll schedule that coverage to start November 1st. So Mary, continuing on your question, if you got your Medicare card, you're all set with Parts A and B. And so now the question is just what kind of additional coverage you want. Susan's asking, where are the costs listed for all the plans? That's something I can help you with. If you give me a call, I can find plans that make sense for you to consider, and I'll show you all the premium information. Or you can find it on our website, fairsquaremedicare.com. Susan, I think I understand your question now. Where are the costs listed for all the plans? So for Medicare supplement plans, the coverage is expressed as a percent of Part A and B coverage. So they'll cover either all of your Part A coinsurance or all of your Part B coinsurance. For Medicare Advantage plans, it's more like a menu. It'll say primary care visit $5, specialist visit $10, ambulance $325. And you can find, if you're looking for that information for a particular plan, again, it's on our website, or you can call me. It's typically listed in a document called the Plan Summary of Benefits. So, Pamela, if you're working and you're covered by your employer, then you might be able to you might be able to defer enrolling in Parts B or any additional coverage. So, if your employer is more than 20 people, I would go to your HR department and ask them, hey, can I defer Part B? Will your plan pay before Medicare pays? And if they say yes, then you don't need to enroll in Part B and you don't need to enroll in additional coverage until you move off of your employer plan. Susan is asking, my husband has VA, but I get my benefits at work. Okay. If I get the VA after retirement, can I still get Part B? Yes. Yes. So once you move off of your employer's health care, you have 8 months, you have an 8-month period to enroll in Part B and then buy any additional coverage. So, frankly, I would actually, what you want to do is say you're losing your employer coverage in September. What you want to do is sign up for Part B and the additional coverage the month before, right? So in August, so September 1, you're fully covered. But you have up until 8 months after you lose your employer coverage to sign up for this stuff before you start being penalized. Do you still pay the 20%? If you only enroll in Part B, yes, you're on the hook for 20% of medical expenses. But if you enroll in additional coverage, like Plan G, you wouldn't be on the hook for that 20%. Different plans will do different jobs of covering that 20%. Linda, we haven't heard from you yet. Is there any, do you have any questions about Medicare? There are. Yep. There are certainly a lot of options. So Mary asks, if you have a lot of medication, what is the best option? Um, so what I do when I help folks choose a plan is I will take down a list of all the medications you take, um, and then I'll find the prescription drug plan that costs the least to you over the course of the year, which means the sum of the premium and all the money you'll spend on drugs is the least. Now, it's really not a function of how many drugs you take, because if all your drugs are generic or preferred generic, they're only going to cost you $1 a month. But if you have a drug that is more rare or is not generic, then they start to add up. And Susan, yeah, we are taping this, and I'll send it out to everyone afterward. So Susan asks, I understand Plan G is the most comprehensive plan, but is it worth it for me? I consider myself healthy, but if I get a cheaper plan, can I switch it to Plan G in the future? Great question. Great question. So for Medicare supplement plans, when you're in your initial enrollment period, you're you have a right called guaranteed issue, which means you can enter the plan regardless of your medical condition. Now, in the future, you actually won't have that right. So you can enroll in Plan G 2 years from now, but there are going to be questions about your health, right? And the questions are very basic. Do you smoke? Do you have any sort of history? Do you have kidney disease, right? And the answers to those questions could result in a higher premium. They could result in you actually doing a medical review in the doctor, or it could result in you being rejected for coverage. So, um, so you can enroll in a Medicare supplement plan like Plan G later on, but it's not guaranteed that you'll be able to. Conversely, if you enroll in a Medicare supplement plan now, it's very easy to switch to another plan. Medicare Advantage plans don't have that same sort of medical screening. There are many Medicare Advantage plans that offer great coverage, right? And so if you look at Plan G and you say, hey, I don't want to spend $93 a month on it, we can probably find you an HMO or a PPO that's going to do a great job of covering you. So you shouldn't think it's not the difference between good coverage or bad coverage. Some people just like Plan G because they want to have complete peace of mind. Frankly, they know, like, I might be overpaying, but I'm never going to have to worry about anything. With a Medicare Advantage plan, if we can find you a good PPO or a good HMO in your area, you'll get good healthcare there too. Thank you, Susan. Feel free to call or use our website or email if you have any questions. Sure thing, Mary. So I'll start with dental. Dental plans will have a premium, and then they'll have a max coverage limit. So, for example, a max coverage limit of $1,000, which means that they won't cover more than $1,000 for you in a given year. On top of that, dental plans typically require you to be on the plan for at least a year before they cover major procedures like a crown or an implant. And this is why I urge folks to really think twice before they enroll in a dental plan, because oftentimes it's just cheaper to pay cash. If you find out if you have some dental procedures you have lined up with your dentist, if you can find out how much he'll charge you or she'll charge you for them if you just pay cash, I can crunch the numbers for you and see if it makes sense to get a dental plan. And a very similar logic applies for vision plans, where oftentimes the cap on the coverage the plan provides is sort of low enough that it doesn't make sense to pay the premium. Linda asks, if you're covered with Medicare Part A and B, can you explain what Part C and D are? Yep. So Part C is just another name for a Medicare Advantage plan. Part D is just another name for a prescription drug plan. So everybody at the very minimum has to have Parts A and B. And then you can get a Medicare Advantage plan, aka Part C, which will also include coverage for Part D, or you can get a Medicare Supplement plan, and separately a prescription drug plan, which will cover Part D. Judith, I'm not sure if we've heard from you yet. Are there any questions we can answer for you about Medicare? Okay. It sounds like we are running out of questions. If anyone would like me to give them a personalized recommendation right now, feel free to call me now, free for the next 20 minutes. Otherwise, I will be sending everybody this presentation and my contact info, and we'll help you get set up with the right Medicare Advantage or Medicare Supplement coverage. So I guess this is a last call for any questions. Thanks for joining, Pamela. Okay. Thanks so much. Have a good Wednesday, everyone.